Good afternoon, everyone, and welcome to the Chamber's webinar series, Vigilant Against the Virus, Confident in Commerce, sponsored by Hawaii Pacific Health. I'm Sherry Minor McNamara, President and CEO of the Chamber, and we would like to thank you for joining us for this important conversation on COVID-19. While the pandemic has quickly disrupted our businesses for many of us, our goal today, and as an organization, is to provide you and the business community with facts and resources to make it through these difficult and unprecedented times. Before we get the program started and turn things over to our panel, I'd like to remind all of the listeners to join the meeting in listen-only mode and to keep your microphones on mute. In the interest of time, we will have a Q&A at the very end of the presentations. In the meantime, please feel free to submit questions during any of the presentations by clicking the Q&A button on the bottom of your toolbar. And for those joining by phone, you can email your questions to Katie Arita Chang at KARITA-Chang@COCHawaii.org. That's Karita-Chang@COCHawaii.org. And those questions will be reviewed at the end of all presentations. So let's get started with the program. It's my pleasure, and we are so thankful to have the Lieutenant Governor, Josh Green, to share opening remarks on COVID-19 and business implications. And we just wanted to thank him for being very responsive to our questions in the past few weeks, even the past month. So Lieutenant Governor Green, we really appreciate you once again. And the floor is all yours.
Thank you, Sherry. You can hear me okay?
Yes.
Okay, thank you all. Thank you for taking the time. Major crisis, obviously the understatement of the century or millennium. We have come to this point, like the rest of the world, as you would expect, when a novel coronavirus, which is an infectious disease that we have no immunity to, cascades through the globe and it's spread through droplets. It's very, very hard to stop. We saw some early successes or mild successes in South Korea. We saw some early abject failures, and I'm not judging, in Italy, where if one doesn't do adequate testing and contact testing and then isolation, a country gets run over. I'm going to say some very basic things because I think it helps to hear them a couple of times. We know that coronavirus is much more lethal than the flu. The flu will affect hundreds of millions of people every year and kill 1 out of 1,500 people. The coronavirus, COVID-19, has now affected over 400,000 people, and it will kill, as of now, the number is about 3%. So that is over 30 times more lethal. Now that number will drop, the lethality, the mortality rate, because we know that the denominator, the number of total people who will ultimately be diagnosed and confirmed to have the disease, is much higher. In Hawaii, we have 90 confirmed cases and 1 fatality. The number was just released an hour ago. So we're at 90 cases. We also have several thousand outstanding tests. The tests are now being done by the private labs. 99+% of all tests that have been run by the private sector. So thank you, private sector individuals. We know your value. I do more than you possibly can know. The Department of Health had very limited capacity to test because early on the CDC had difficulty getting tests out and the supply was very, very constrained. We are fairly well suited to test a lot of people. And the testing now is for people who are symptomatic or who are high risk, such as healthcare providers or people who work or are around long-term care facilities and other health facilities, or who are first responders. The goal is to find out as much as we can about who is positive so we have a basic understanding of where we have to prepare our hospitals to go in the coming weeks. Now, I'm going to share a couple things that are somewhat scary with people because I know that you guys want the real deal. You guys are the leaders of the state. Here's the story. We have 3,031 licensed beds, hospital beds in our state, 3,031. As of yesterday, the percent occupancy was 65%, meaning that 1,970 of our beds, our licensed beds in the state of Hawaii, were filled. That's not bad. Also, we have the potential to surge 437 beds. That's about 15% and that's by closing down surgical theaters, optional surgeries, elective surgeries, and turning those into extra beds and some other wings of hospitals that weren't used. So we could get to another 437 beds. So therefore, we have about 1,400 beds available. Here's the scary part. We only have 328 ICU beds and 431 to 560 ventilators, depending on what's in operation at any given time. The reason we have to go into lockdown and why we did go into lockdown is because in countries that did not do that, and I'm talking about home isolation, call it home quarantine if you want, but full isolation unless you are essential healthcare or workforce service or food service, we have to get food and healthcare, and that is it for the short term. There can be some small, of course, caveats to that. The rest of us will work at home the best we can and very professionally. If we have a rapid surge, and I mean like this, zip up and then a big spike down, that's what happened in Italy and Spain. If we saw 35 to 40,000 cases very quickly in the state of Hawaii, 5% of all those individuals, 5% would be ultimately in the hospital. Can you imagine what that would look like? Imagine if a full 30% of our state, that's about 400,000 people, got sick very quickly. A lot of people are asymptomatic carriers and could be spreading it. If we saw that surge and 5% end up in the hospital, 5% of 400,000, so 10% would be 40,000, 5%, 20,000 individuals would be severely ill, because 5% of all COVID cases are severely ill. We have no capacity to take care of 20,000 people that are severely ill. I just explained we have at most 1,500 beds. That's the scenario in which people would be getting either put on a ventilator or not, depending on a decision that was made in a triage capacity at a hospital. This is why we're doing the right thing, in my estimation, to really bring the hammer down, to shut it down and just bring it in slow. Slow up, slow down. Because if we do that, we have the capacity with our healthcare personnel to take care of those who get sick for the period of probably about 30 days, maybe even less, get them quickly out of the hospital once they're no longer critically ill, and then home. That's the way to beat this without having mortality all over the place. In addition to that, that's the way to prevent massive economic crisis. Now, needless to say, and I won't go on too long because we have other, actually far more expert speakers than me. Needless to say, we're going to need significant financial support across the board. We're getting the word, and I may have passed it in the last hour since I last saw the television, that the bailout package or the emergency package passed. I can tell from the stock market that there was some event. Obviously, the market went up 2,000 points today. So the stimulus has passed. What we will need to find out is which industries got direct support, whether it's airlines, hotels, cruise ships. I was speaking with Senate President today, who did a very good job, by the way, explaining some of the additional nuances of what's going on. We waived the 1-week waiting period for unemployment. We will probably have to make sure we have some technical answers on other things, such as the usual necessity to have people go look for 3 jobs before they get their benefits. Obviously, we don't want people out there looking for jobs, impossible. We'll have to shore up the unemployment insurance system. We have to probably prevent foreclosures of any kind for, I think, at least 90 days. We should provide rental support for people who are in the ALICE category, who are in deep trouble, so that they do not become homeless and more vulnerable. That's already in the works with the Aloha United Way reinstituting the Sishi program. That was direct payments for rent for up to 2 months. We might move, and this I defer to your recommendations, to interest-only payments for a time. We delayed taxes, as you know, the state taxes till July 15th. I would rely on people like you, powerful individuals who are very thoughtful, to lean heavily on the governor. If you think we should also defer general excise tax, you have to recommend things. Taxes on healthcare. These are some of the considerations that we have to make. And then finally, we have to set up areas where we can take people and let them self-quarantine if they have to come out of the hospital. We will have to have throughput from the hospital. And if you have the capacity, and we've begun these conversations, to speak to a hotel that might be very interested. I know these conversations have begun to go on. That might be willing to dedicate their facility. Maybe a hotel that is not going to reopen again in the future, that was already planning on closing. We're hearing there are a few in that circumstance, that they went and they used their facility, received resources from the emergency funds to be available for us to pass through individuals so they come out of the hospital. these are some of the considerations that we have to make. I think we also have to look very seriously for the short term, and hopefully some of these things will not be necessary, at potentially using the convention center or the Blaisdell to have people do quarantine in space and in place after they've been infected and are away from all other individuals. The goal is to get through this and begin to resume some normalcy on or after April 30th. That, I think, is the best we're possibly going to get out of this, and it is at least then a finite consideration for what the immediate shutdown looks like. Of course, there's much more long-term considerations with which I'm sure Bonham's going to give us, and so many, about what it will look like for flights, rates, revenues from the hotels, and so on. This is going to be economically calamitous. However, I also anticipate an extreme desire once the stresses, the fears, the fatigues, and the fatalities pass from the COVID-19 crisis. I think by fall, maybe even late summer, there will be an unusually pent-up demand for people to return to normalcy, travel to Hawaii, to have full employment. So I'm hoping that this is much like an explosive crisis, that once people are shaken out of it, can return to normal and desire to resume their lives. So that is the overview that I wanted to give. And I just thank you so much for welcoming me and letting me share some of this data. There's a lot more to share, but you have other experts to hear from today.
Thank you, Lieutenant Governor. I really appreciate your response, your discussion, and it just reinforces the need to do our part in staying home and really implementing the social distancing. I hope you can stay with us because we do have some questions that have come in for you. So I am now going to go on to the next speaker. And at this time, it's my pleasure to introduce Brooks Nelson, Senior Director of Global Resilience Corporate Citizenship at the U.S. Chamber of Commerce Foundation, to share with us about the federal policy updates and activity at the federal level, as well as issues relating to business operations and resilience. And we'd like to thank the U.S. Chamber as well. Here at the Chamber of Commerce Hawaii, we've been on a number of calls already with the U.S. Chamber team, and they've been very helpful in providing us guidance as we move forward together. So Brooke, I'm going to turn it over to you.
Thank you, Sherry. Can you hear me okay? I had to switch over to my phone.
Yes.
Okay, great. Well, thank you for including us, and I'm going to go to our slides here. Okay. And thank you, while I'm doing this, thank you, Lieutenant Governor, for your leadership. Great report there. Appreciate all that you're doing. And Sherry, thank you for the Hawaii Chamber and your leadership in doing this as well. So as discussed, I'm going to talk a little bit about what we're doing here at the national level with the U.S. Chamber. I'll touch on some of the federal pieces, the legislation that's currently being debated and hope will pass very shortly, as well as what has also passed. And then also talk a little bit about some of the resources that we've been providing here at the Foundation and at the Chamber of Commerce, because we are definitely committed to helping American business respond to this virus, because we know they need to be ready to support their employees, their customers, and your community. So we want to equip you with the tools and resources and information that can help you navigate this challenge in real time. We know there's a lot of information that's being circulated on COVID-19, so to help synthesize the information for business, we have created several links, which you see on the screen. So the first link there is managed by the U.S. Chamber of Commerce. It's a great resource. I'm going to highlight a couple of the items that are on that site, but encourage everyone to go to that site to see some of the economic impacts that we've released, as well as some tools for business. The second link on there is from the U.S. Chamber of Commerce Foundation, which is where I sit. We have a number of resources for businesses thinking about how they're going to play a role in the community and what response you're going to be providing from a corporate social responsibility standpoint, how businesses can interact with the education system that's been disrupted, employee assistance funds, and then also highlighting some of the national nonprofits that have activated in the communities. And then we at the Chamber are gravely concerned about the impact that this virus is going to have on small businesses. And that third link on the screen is a resource for that audience of where different funding is available. I know that we're going to hear today from the Small Business Administration, and they've been a fantastic partner of the Chamber of Commerce. And thankfully, there's been significant amount of funding already allocated to SBA, and we've also seen some grant programs stood up as well. So the U.S. Chamber of Commerce does have a small business disaster help desk, which we have activated. So if there are any small business members on this call, you can reach that at 1-888-MY-BIZ-HELP. So as I mentioned in that first link, we have created a number of resources and tools for businesses. According to the Edelman Trust Barometer, 74% of employees see their employers as the most trusted source of information. So we wanted to make sure it was easy for you as a business owner to be communicating to your employees and your customers. So here's two examples of the guides that have been created. These guides are based on information from CDC and WHO and other trusted sources, but we hope that we've helped synthesize all of the information that is out there and made it a little bit more digestible for you and your employees. We also know that your customers are critical to your business, and you are currently taking important steps to ensure that you are communicating to them and educating them on how you are helping with their safety. And so this is a customizable flyer that you can either post in your window front or use as electronic to communicate with your customers. Again, all of these resources are available at uschamber.com/coronavirus. Before we move into some of the federal pieces, we do know that during times of disasters, we're reminded that preparedness and mitigation is critical to maintaining business continuity. U.S. Chamber data we have shows that 65% of small businesses have no plan in place, and that number grows when we talk about pandemics. So we've created a tool called Resilience in a Box. Small businesses can open this now. There's a checklist that you can utilize as you are continuing to live through this current global crisis. So with that, as Lieutenant Governor mentioned, some federal legislation has already passed. So we've seen the supplemental and the Families First Act. As was mentioned, we have the $8.3 billion in emergency spending, which does include $2 million for SBA and the Economic Injury Disaster Loan, which I'm sure our SBA speaker will talk to. And then, of course, the paid sick leave, which was also mentioned. But we are waiting for the latest emergency package, the CARES package, to go through. And at the Chamber, we've been really pushing for three key things, similar to what the Lieutenant Governor highlighted. But again, we're looking to suspend the payroll tax at least for 3 months. We want to expand small business lending and make sure that we're providing emergency loans to some of the largest employers. So this shows kind of a graph going to that payroll tax. It displays the benefits for the employees and the business, because for every $1,000 paid to an employee, a little more than 15% is held back for the federal tax payroll. And so this goes even further. If we look at around $100 billion collected every month in federal payroll taxes, if we're able to suspend the payroll tax for 3 months, that opens up $3 billion to be pumped back into the economy and provide relief to your employees. So we're continuing to push this and hope that it'll be included in the package that will be voted on, if not tonight, tomorrow. As I've already mentioned, small business is key priority for us. One of the resources we've created is some messaging and communication for small businesses and customers to promote what you can do to help your business. These are available on our website. There's social media marketing pieces, and we encourage you to share these far and wide and support the small businesses that are going to be impacted the most. So finally, before I turn it over do want to highlight that American business really plays a vital role in combating the outbreaks of viruses, and they do so much from providing the vaccines and the medical care to supporting the communities and the small businesses that are impacted. And so at the Chamber Foundation, we have our disaster corporate aid tracker, what looks at what businesses are doing in response to those disasters. So to date, we've tracked over $755 million in-kind and cash donations from businesses in response to the coronavirus. There were too many to share, but I've highlighted a few on the screen and really thank businesses for stepping up. I encourage you to look at that tracker, get ideas on how companies are responding. If your company has responded and is not included on that tracker, please be in touch with me at bnelson@uschamber.com. We know this is a global challenge that's going to require global engagement solutions. Pandemics know no border, and no single country, no matter how powerful, can defeat the threat. We're working closely with all our partners and appreciate all that you are doing there in Hawaii to rebuild the supply chain and restore commerce. And we hope that soon we'll be reviving the growth. So thank you so much. And with that, I'll turn it back over to you, Sherry.
Thanks so much, Brooke. I really appreciate you taking the time. As I know, there's a 6-hour time difference. For everyone on the phone, I encourage you to go to the U.S. Chamber website as well as the U.S. Chamber Foundation. They have a tremendous amount of resources that you can find helpful. So thanks again, Brooks. At this time, the next speaker is Jane Sawyer, District Director of the U.S. Small Business Administration, to share information about the federal loan assistance programs, which may help with your financial health of your organization. And I know Hawaii was recently approved to receive the federal loans. So Jane, your presentation will be very helpful for many of the listeners today.
Okay, hello, and thank you everyone for joining us. This is Jane Sawyer. Struggling to see if I can bring this screen up here, since I'm not the techie side of the organization. So let's see here. Okay, maybe that's not going to work. I guess I think that Tricia has the presentation to share with everybody, and we can just kind of walk through really quickly I think what everybody wants to know is, how do we apply for an SBA disaster loan, the economic injury disaster loans. This is unprecedented for this kind of situation across the country. Normally, big disasters have come up like 9/11 or Katrina, Rita, Wilma. Those physical disasters that we've seen across the country have had just a huge response. But this time, this is a national disaster. The declaration came down for Hawaii on the 20th, and we had the website up and open that day. The SBA disaster loans, the economic injury disaster loans, were made under a special authority that came to SBA from the Coronavirus Preparedness and Response Supplemental Appropriations Act. So SBA is now able to, under their own declaration, to make loans for small businesses suffering from this pandemic, the economic impact of the pandemic, up to $2 million. So that's a sizable amount of a loan that is available to all the small businesses in Hawaii. Of course, all small businesses, small agricultural cooperatives are eligible. Aquaculture businesses and most private nonprofit organizations can be eligible. And again, one big difference is that this is a national effort. It's a national approval, so the demand is very, very high. And this is not for physical damage. It's not for growing your business or buying a building. This is to replace what your losses are, the losses that your business is experiencing as a result of this outbreak. So up to $2 million sounds like a lot of money. As I said, it's going to be replacing what your business is not earning because of shutdown, releasing employees, people not going to restaurants, the important effort to help people shelter in place, we also want to keep the small businesses going. The long-term loans, the interest rate for this disaster is 3.75 for small businesses for a term of up to 30 years. So that's over 30 years to help keep payments down. Again, it replaces lost revenues or what you're not going to be able to make this year. So there are some different criteria in the application that you do have to look at. All the applications are online, but again, that is really overwhelming in what we're able to look at. Excuse me a second, the screen is flashing. I don't know if you can see this or not. So again, loans up to $2 million, 3.75 interest for small businesses, and 2.75 for nonprofits for terms of up to 30 years. And it's for working capital based on the size of the small business. You must be a small business. It does look at what other resources that you have available. The working capital loan can be used to pay fixed debts, payroll, accounts payable, and other bills that could have been paid had this declaration and this disaster not occurred. So the kind of small businesses that can apply, eligible industries include but aren't limited to hotels and restaurants, recreational facilities, sports vendors, entertainment, including things like charter boats and tours, manufacturers, retailers, wholesalers, travel agencies, even owners of rental property can apply for a disaster loan. The applicant business has to have a physical presence. We see so much going web-based now, but you have to have a physical presence here in the state of Hawaii. You may have a business that's located in another location. All states and all the territories are all also eligible under this declaration. So there are a lot of people who will be applying for these loans. The funds don't come from a bank. You don't have to apply by going to a bank as you would with one of our regular guarantee loans. The funding will come from the U.S. Treasury, and your payment when you get disbursement will come from the U.S. Treasury. So to apply, you can go directly to SBA's Disaster Assistance Program on the web, disasterloan.sba.gov. There's no cost to apply. There's no obligation to take the funds if you are approved, and you don't have to take a loan if it is offered. Applicants can have an existing disaster loan and still qualify for another economic injury disaster loan, but the loans won't be consolidated. They'll still be separate. You can have an SBA bank loan, a regular loan, and that can still, I'm sorry, the screen's flashing again here, so I don't know if you're seeing this or not. But you can still get another SBA disaster loan with the extended term. So the questions are, what do you need to apply for the loan? There are probably 4 or 5 documents. You can get them and download them so you can prepare in advance. As I said, the applications are online are really crowded. People are reporting that, you know, the system is really overloaded, and we're working hard to expand that by adding more broadband, you know, and also to get more call center support by even looking at expanding our contracts to the private sector, because this is just so unprecedented. People have been on hold for 4 and 5 hours. So we're really recommending to call the Hawaii office or email the Hawaii office at hawaiigeneral@sba.gov, Hawaii General spelled out at sba.gov, to request the documents and forms so you can take a look at them, get the information ready so you can either prepare one of the other documents to either upload if you can get through working on off hours. The center is open and you can get responses from 8 to 8 Eastern Standard Time. So that doesn't help us a whole lot here, but it does give us the opportunity to apply when the system is down for the rest of the mainland. So going after hours or in the evening after everyone on the mainland has probably shut down or tired of trying to get in there, to go ahead and try to upload or process your application at that time. One of the documents you need is called, it's the SBA loan application. It's the Form 5 or a Form 5C if you are a sole proprietor. Two different documents there, but that'll ask basic information about your business, and you need to complete that form. You need to complete an IRS Form 4506T, a tax information authorization. It's a one-page document, and you need to complete that if you're the owner of the business, or the principals of the business, or any other business affiliates that you may have. You may have two locations. You may have them on separate, tax filings and things like that. You would combine those because you're affiliated business, but you still need to be considered small to make the application. We will need the completed copy of your most recent federal income tax return, including the schedules. So this one, you can just download it and attach that, print it out and attach it or upload it. It's also, they're looking at streamlining this requirement, so it won't be required of you if you're looking at a loan that is under $500,000. So I think that many people will be looking at those smaller working capital loans, because this should go over the next, hopefully a shorter period of time, but maybe the next 6 months, until we can get past this, pandemic and into the recovery mode for the economy. But that new streamlining measure, again, would mean that you don't have to attach the tax forms for your business and for your principals if your loan request is under $500,000. You need to give a schedule of liabilities, an SBA Form 2202. That is to indicate what your fixed costs of your business are. What's your payroll? What's your rent? What's your overhead cost? What's your inventory cost? What are you committed to spending to keep your business operation going? And then the personal financial statement, again, SBA Form 413, for anyone who owns more than 20% of the business. So anyone with over 20% of the business will need to complete that form. Some additional information may be requested of you based on the type of business that you operate, meaning, what is your business entity? Are you a corporation, an LLC, et cetera, et cetera. And some of that other information could include the federal income tax for all the principals, general partners, or managing members, depending on what type of entity you are. If your most recent federal income tax return has not been filed, you'll need to get a year-end profit and loss statement and a balance sheet for that past tax year. You'll need to submit a current year, year-to-date profit and loss statement. That also shows them what you were anticipating doing before this situation came and interrupted everything we're hoping to accomplish in this year's business activity. Additional filing requirements in SBA Form 1368, providing your monthly sales figures. It's pretty much a requirement for an economic injury disaster loan, but that really helps them assess not only what you'll be asking for, but your repayment ability, what your loan amount, and how we need to come in and help you continue to operate your businesses. So, as we said, most small businesses will be eligible, but some types of business are not eligible because of their type of operation or where other assistance may be available from the other stimulus packages and other government agencies. For example, agricultural enterprises. Most farmers will get help from USDA through their grant or loan programs. Religious organizations, charitable organizations, gambling concerns, casinos, racetracks, things along that line. So, if you generate most of your income from gambling activities or poker parlors, casinos, they're not eligible for EIDL assistance either. And other businesses that are determined to be illegal under federal law, some of our dispensaries and things like that, they are legal here but not legal under federal law, would not be eligible. Many times they go on a case-by-case basis. So if you have a type of business you're concerned may may not be eligible. Say you're a daycare facility that is owned by a nonprofit entity or something like that, make sure you give us a call and we'll try and determine on a case-by-case basis if we can figure a way to get you qualified for one of these economic injury disaster loans. The electronic loan application is available at SBA's secure website, https://disasterloan.sba.gov. You'll be able to find that pretty easily. Again, disasterloan.sba.gov, and that should take you to the website. The website will show you the current disaster declarations. It will also show you the coronavirus declaration. So you'll be able to scroll down and find Hawaii. That will open up our portal and get you into the right queue for Hawaii businesses. Paper loan applications are also available and can be downloaded at www.sba.gov/disaster. And then those completed applications, you compile it all together, package it up, and then mail it to the U.S. Small Business Administration in Fort Worth, Texas. Do send it on a traceable form of mail, from the post office or an overnight mailing, so that you know you're going to be able to track it and make sure you get delivered. More information and applications can also be obtained by calling our customer service at the 800 number, or you could call the Hawaii District Office at 808-541-2990 and get somebody at our office. We are still here working for you. We are down to a skeleton crew, bare bones here, but people are working remotely to help answer your questions, respond to your email inquiries and things like that. We're keeping our other programs open and available too, to make sure that you're getting the assistance you need during this time of great uncertainty. So people are here, and we will assign people to get back to you as soon as you can. We do find that people are having a lot of difficulty and long delays and waits going to the major disaster lines in the customer service centers. We're hoping to see that improve in the coming weeks. Meanwhile, please let us know at the Hawaii office how we can help, and we'll get the information, the forms you need, and things like that. We'll also be issuing some press releases regarding some how to apply for a disaster loan. Webinars in the next coming weeks. We'll be posting those online at sba.gov/HI to let you know when those will be occurring. We also have assistance from our resource partners, the Hawaii SBDC, the Small Business Development Center, our SCORE chapter, the Patsy Mink Center for Business and Leadership, the Veterans Business Outreach Center of the Pacific. They're all, again, most of them are working remotely, so they are located on different islands, so they may be more accessible to you, and in providing you via their websites or via email the documents that you need, and then all the assistance. If you need help compiling or proofing your P&Ls to submit, if you want to look at your cash flow projections, if you need help to make sure the application is completed, they've helped us through this before on Kauai, on the Big Island, several times. So these are key partners to help get you through this difficult time. But again, we have lots of information, and we are here at sba.gov/HI, or Hawaii General at sba.gov via email. Thank you.
Thank you, Jane. Thanks so much. That's a lot of information. Certainly understandable that there's a process to that. I just wanted to let the attendees know that the Chamber will be holding a webinar on this to help you apply for the SBA loan. And so in addition to SBA's partners here, we will also offer some resources as well from our expert members. So thank you. And thank you, Jane, again, for participating on this. There will be questions at the end, though, so please hang on. we were going to save all the Q&A until the end, but I know Lieutenant Governor actually has to go and attend to other meetings. So there's a few questions for him. So one, LG, is that we have many members who are doing their part for the greater good of Hawaii by donating resources. And one of the questions we have is, where can we help donate masks? And I know that's a huge demand right now.
Yes, so the two places to do it would be to our office. We'll take them and give them to the Healthcare Association, or directly to the Healthcare Association themselves. Someone brought us 950 masks yesterday, and we immediately were able to distribute them to the housing experts in the homeless community, where they are taking care of people. But if you could bring them here, we're going to have a big drive on Friday.
Great.
We or Hilton Rathel. Everyone should know Hilton Rathel's cell phone or his number over at the Healthcare Association, because they are the main stockpiler of resources and have done some massive orders recently. So they're distributing them to all hospitals.
And Hilton is with the Healthcare Association of Hawaii, correct?
Yes.
The other question is, and unfortunately, Director of Labor Scott Murakami had to cancel at the last minute. So hopefully you have the answer to this question. If not, perhaps guide this attendee to the right direction. And the question is, what options are there for sole proprietors and LLCs who are going out of business but didn't pay into the unemployment insurance fund based on the nature of their business structure?
I'm going to have to be honest. I think we'll have to defer that question. We can get an answer and then we can send it out by email. I think that Scott will have to answer it, only because I don't really know that I'll give an accurate answer.
Okay, we can work with you on that, and we'll make sure to email the answer to the attendees.
Yes.
Thank you. The other question we got on Facebook, and I think we've heard this a number of times, but nothing like reinforcement. But the question was, why is social distancing important? So
social distancing is important for two reasons. First of all, let me remind people that we're going to isolate at home now. We're going to be in full home quarantine anyway. But even so, social distancing, which should be done with our friends and family if we have any illness whatsoever, it's important because the virus can travel about 6 feet based on droplets. So that's 2 arm lengths, basically like this. So if you do that and you're out 6 feet away and you're not directly where someone could cough or sneeze on you, the likelihood of you becoming positive is very low. Also, if someone is sick, let them have a mask on if they do have one, to prevent the droplets spreading outward. The mask, unless it's an N95 mask, will not protect a person coming in. That's the reason for social distancing. And every which way we can chop down the spread of the disease will be 1 hour or 1 day or 1 week faster. We can get back to normal operations, lower risk, normal business. So important.
Thank you. That's the number of questions we have, and we want to stay on track. So we appreciate your time, Lieutenant Governor, and we will definitely continue our discussions with you.
And I can do quick hits for you guys if you want to bring them up. I'll be available anytime. My apologies that there's just an Army official that wanted to brief me, and I'm afraid that if I lose them, I'll lose the opportunity to hear from them. So thank you all so much for everything you're doing.
Great. Thank you. Thank you, too, for what you're doing.
You bet.
Okay, our next speaker is Carl Bonham, the Executive Director of UHERO, and he's going to provide a local economic perspective and update. Before I turn it over to him, we've been doing a number of surveys. We sent out 2 so far to our membership, getting a pulse of where they are now and what our members need as in the current situation and as we move forward to economic recovery. And just to recap some of the responses, overwhelmingly and obviously, more than 85% expect an economic downturn. Currently, half respondents have already closed their operations or are operating on a limited basis. 65% have already cut employee hours, laid off furloughed employees. And so it's definitely a dire situation, and I think we need to face the facts of what the current economic situation is, and then hopefully Dr. Bonham can provide what do we see ahead of this. So, Doctor, I'm going to turn it over to you.
Okay, thank you, Sherry. I'd love to see the results of your survey. I was actually thinking that would be really useful information to have on the number of businesses that have already laid people off, and So the numbers that I'm going to present here are still preliminary. I mean, things are obviously they're just changing so fast. So, for example, in this forecast we've included an estimate of the Senate Republican bill's economic impact on Hawaii, and yet that bill, which hasn't passed yet, is inadequate. And if we don't know how much economic relief we're going to get from the federal government, and that's where it has to come from. And so these results will change tomorrow if we get a bipartisan bill that reflects the Democrats' proposal that the House is considering. So anyway, they're extremely preliminary. We hope to release a new forecast soon, and so this is take it with a grain of salt. So there's your first very ugly picture. To put this in perspective, this is U.S. real gross domestic product. And 2 weeks ago, when we were working on the forecast that we released 2 weeks ago, instead of what we have now, which is about a -4 to 5% drop in real GDP for the U.S. for 2020, and collapse of over 25% in the second quarter. 2 weeks ago, we had about a 1.5% decline in real GDP, and the second quarter was -8%. But the spread of the virus, how rapid it's been, and the lack of a shutdown, as Lieutenant Governor mentioned over and over, shutting down, social distancing is so crucial to being able to get back to business quickly. So our forecast as of right now is roughly a 4% drop in real GDP. To put that in perspective, in 2008, real GDP only fell by 0.1%. It fell another 2.5% in 2009. So we're talking about a recession that it is much worse. It's really not a recession in your typical way of thinking about it. We're shutting the economy down for however long it takes, for weeks or months, hopefully not more than months, and then we need to restart the economy, right? That's sort of the key, and that's the key to the economic policies that should be forthcoming from Washington. And this is not just about shutting the economy down in the sense of lack of supply or lack of demand. It's also showing up in financial markets, as you are all very aware, but you may not be thinking about what that means for what is essentially a liquidity crisis. That the bond market, this is a spread between basically a junk bond and a treasury bond, and so we're looking at spreads that are higher than they were when Lehman Brothers went bankrupt. Not as high as they were during the depths of the Great Recession, but the spread is basically predicting a large increase in corporate defaults. That then translates into additional strains on the financial system and the potential that essentially credit won't be available. And that's what the Federal Reserve is working so hard on, is to try to get the financial markets working again, functioning, so people can get credit when they need it. And they're also looking at increasing their lending across a wide spectrum of everything from municipal governments, municipal bonds, to a variety of types of corporate bonds that they haven't purchased in the past. And so the Federal Reserve policy has basically been very, very clear that they will do whatever it takes. We haven't yet seen that from fiscal policy. The reaction of the market today was hopeful of an agreement between House Democrats primarily and Senate Republicans, and the buy-in of the president that will get fiscal action quickly. The stock market volatility also matters, and you often hear people talk about, well, the stock market isn't the economy, but when corporations valuations have gone down as much as they have, I mean, that's essentially their net worth. And I mean, I'm kind of preaching to the choir to some extent here, at least for the people in the room who are publicly traded. That reduction in net worth then makes it very, very difficult to borrow, and we're sort of facing down a financial crisis. And so the problems that make this period so difficult to forecast are essentially, you don't know how long the virus is going to spread. We don't know what recurrence will look like if it starts to recur in fall and into winter, because we simply don't have the data yet on what's happening in China with recurrence. It hasn't been enough time hasn't passed to see what happens when you bring cases down to zero in China, or you really constrain cases in South Korea or Singapore, and then months later, as you start to open up your economy, what happens? So we don't have that information, and how quickly you get past the virus, the spread of the virus, depends on policy, right? It depends on the kinds of policies that we're adopting here in the state of Hawaii that aren't being adopted everywhere else in the country. And we need the virus not only to be under control in Hawaii, but we need it to be under control in the rest of the country and globally. And so those things make it incredibly uncertain about how long this process will take. And then the overall policy response also introduces uncertainty about the recovery. What we do know right now is that the efforts to not only the efforts that we're undertaking, but the spread globally has brought tourism down dramatically. This data, we just recently added the daily data, but these are weekly data. So it's as of the last week, total passenger counts in the country, in Hawaii, were down 61%. As of last Friday, they were down 80%. So even before we implement the quarantine, visitor arrivals or passenger counts were down to only about 20% of where they were a year ago. And when you take that information, and we're not just using backward information, we're using assumptions about how many people will travel. These are quarterly forecasts for total visitor spending in real dollars. And this kind of gives you an idea of how we can't keep up and the deterioration in the outlook. So the forecast from actually I think it was March 10th, but the orange line was our previous baseline, and the blue line was our previous low scenario, the light blue line. That now looks like an incredibly optimistic high scenario. The dark blue line includes our estimate of the effects of a near complete shutdown of air travel for the month of April, a mostly shutdown for May, and some beginning recovery in May and a little bit more in June. So we're talking about visitor spending for the whole year down about $7 billion, or 42% lower than a year earlier. And as you can see from the chart, the recovery still happens relatively quickly into 2021 and 2022, but it's not complete. It essentially gets us back to 2014, 15, 16 levels. it doesn't get us all the way back to the peak back in 2018 over this forecast horizon. And so the other thing that we're dealing with in trying to figure out the magnitude of the impacts are it's not just the quarantine. This is not just a tourism event by any stretch. This is a shutting down of the economy. And the best data we have on how many workers there are in food service dates back to 2018. I think the numbers are still, I'm sure they would be a little bit higher, but we really haven't seen that much we didn't see that much job growth in 2019. Actually, we saw job losses in 2019. So the 86,000 jobs in food service preparation represents a pretty reasonable estimate of how many jobs we were starting with. And the vast majority of these have already suffered layoffs, hours reduction as we go to takeout only. And in terms of policy responses, really we have to be thinking about how do we restart the economy once we have the virus under control here. So once we've gone a month with our shelter in place and we're testing widely, right? Those are keys that I think Dr. Green would agree that we need to test as many people as we possibly can, and we're actually doing a pretty good job of catching up with testing. Then we can get a handle on when we can relax the shelter in place, and then how do you go about reopening restaurants? Are we going to reopen them with full capacity, or are we going to suggest still some degree of social distancing, so maybe fewer tables? Those things have to be sort of worked out now while we're in shutdown, so we can get some of these 85 or 86,000 workers back to work. And in the forecast that we're looking at right now, we are looking at numbers, total job losses from peak to trough in 2020 that are very, very close to 80, 90,000 jobs. And that's peak to trough. For the whole year, it's not as severe because we are forecasting that we'll begin to get, the local economy will begin to get back to work, hopefully in May, June, July, and then we'll see how we can reopen the tourism economy as well, which will depend on testing nationally, testing globally, the progress of the virus, and then also people's willingness to travel. So when you put all of it together, and there's my preliminary and incomplete, do not quote or distribute.
Hey, Cara, I apologize for interrupting, but we only have a minute or more to stay on track with the other speakers. If you don't mind wrapping up, that would be great. I know it's a lot of good information.
This is my last slide. So this just gives you an idea of the kinds of losses that we're talking about right now. Roughly a 7% decline in job counts in 2020 and a 2.5% decline. So the real income numbers here were based on using the earlier version of the Senate Republican bill. If we doubled the amount of money that was coming into Hawaii from the federal government, which I think is possible when you get a bipartisan bill, I think we could be looking at well more than $1 billion in direct payments to households. Then that 2.5% decline in income shrinks to more like 1%. So that's really what needs to happen with policy, is it needs to replace the income that's lost by the workers and the businesses that have suffered from this outbreak. So it's not really about stimulating the economy right now. It's about replacing income, and then 6 months from now or 3 months from now, whenever we can really get back to business, shouldn't have said 6 months from now, 3 months from now, hopefully, then that's when you want the stimulus. And so, as I said, they're preliminary, they'll change. We're going to post a new forecast update as soon as we can. Mahalo.
Thank you, Dr. Bonham. Really appreciate that update. Hopefully the next one, we'll be talking about economic recovery and looking at more positive trend in numbers, but really appreciate you giving a real outlook of the current situation. The next speaker is John Knorek, a partner of Torkildson, Katz, Hetherington, Harris, Knorek law firm. And he is going to talk about labor laws and work from home policies, as many of us have had to transition to. Many of us may not have been prepared, so he's going to provide some useful and valuable information as to how we can adjust to this unprecedented times.
Thank you, Sherry. Thanks for having me. Thanks everybody for listening. Let me first say, it's unfortunate that, but even in a national emergency, our employment and labor laws are not suspended and we have to comply with them. The laws that we're going to kind of try to touch on today are the OSHA, our state and federal safety and health laws, our discrimination laws, the Americans with Disabilities Act, the ADA, Title VII of the Civil Rights Act. We're going to talk a little bit about that. Family leave, the federal family leave law, which was amended recently, the National Labor Relations Act, the Fair Labor Standards Act, which requires you to pay people minimum wage and if they're exempt, comply with the salary basis test, among other things. The Worker Adjustment and Retraining Notice Act, the WARN Act, which requires you to give notice of closings or layoffs of a certain size. And finally, the new law, the Families First Coronavirus Response Act, the FFCRA, which modifies the Family and Medical Leave Act, as well as mandates paid sick leave. So we're going to try to touch on all those. That's a big order, and I know I had prepared a PowerPoint. I think everybody should have it. If not, it's also on our firm's website, but it will detail some of these things or most of these things, but it's too lengthy to try to cover here. So I'm going to try to just talk through this and hopefully be able to answer your questions at the end. OSHA, as you know, requires all employers to provide a safe workplace. And that means when you are aware of known hazards, you have to take steps to prevent them from being causing accidents. Obviously, there are now protocols imposed by the governor's order as well as the mayor's order that we need to comply with if we're still open. If you're an essential business and you have workers doing anything, you need to make sure we're taking those necessary steps, including social distancing and alcohol wash and washing hands and all the things that are required. And part of that also could include administrative policies on leave and travel, and we're going to talk about that in a little bit. The Americans, if you still have employees working, the Americans with Disabilities Act is applicable, as well as state disability law that precludes any kind of discrimination with regard to individuals with disabilities. And it regulates the right of an employer to get medical information or require employees to undergo medical exams. And so in this era of fear about transmission of the virus, we have to be careful that we comply with the disability law when we are curious about other people's health. The ADA now, the EEOC, which administers the ADA, has said that employers can now take employees' temperatures to determine whether they have a fever, which would indicate that they need to get medical treatment or diagnosis before they can come back to work. If employees are displaying symptoms at work, you can ask employees to go home and get a doctor's note before they come back to work. If employees have traveled, you can refuse to put employees to work or make them self-quarantine for 14 days to ensure that they're safe to return to work. In fact, you can even ask employees who have taken time off from work why they were absent. What you cannot do is you cannot ask employees if they are high risk. That is, do they have some kind of immune disorder or an illness that would make them a high risk to the coronavirus? That would be an illegal medical inquiry. You cannot just simply quarantine people because you know they're high risk. If they're over 65, or if you're aware of a medical condition, you just cannot treat them differently because of their high risk status. That would be disability discrimination. Unless you can show, and there is an exemption, that those individuals present a direct threat to their own health. That is a significant risk of imminent harm to themselves. That's a pretty high standard under the disability law and would require a careful analysis to do so. Employers actually can prohibit employees from traveling now, even on their own. There was a case that was just decided last December that stemmed from the Ebola crisis years ago, where a massage therapist for a company called Massage Envy wanted to return to Ghana in Africa for a family funeral. And their employer said, we don't want you traveling. We don't want the risk of you returning with some kind of Ebola virus, so do not travel. And the employee traveled anyways. And Massage Envy fired this employee. The employee sued, claiming disability discrimination and race discrimination. The courts finally sided with the employer and said no, they were simply trying to preserve and protect a safe workplace. Okay, so that's the ADA. Title VII and our state discrimination law also will apply to your employees if they're still if you're still open and operating. And what this probably implies is that harassment or discrimination based on one's ancestry or nationality is prohibited. The Attorney General of New Jersey just issued a guidance memorandum that said kidding or joking Asian ancestry employees about the Chinese virus and things like that would be harassment under the discrimination law and illegal. So employers have to be careful not to allow kidding around or joking about a virus that would imply somebody's nationality was involved. Title VII also covers pregnancy, and we have pregnancy protection in Hawaii. Simply because a woman is pregnant does not give you the right to say, oh, we can't hire you because of the co-virus. That would be pregnancy discrimination. So we have all these laws that still apply, and even if you're still operating. Now, either you're now or when business comes back and you reopen and there's still the fear of the virus or people getting the virus, come April 2nd, a new law takes effect. Congress passed a law last Wednesday, and the president signed it, called the Families First Coronavirus Response Act. It has two major provisions that affect employers. The first is a paid leave requirement. All employers that have fewer than 500 employees have to provide 80 hours of paid sick leave to every employee. If you're part-time, it's prorated for part-time, but 80 hours for full-time employees. The other part of the law modifies the Family and Medical Leave Act and says for all employers with fewer than 500 employees, you will have to give 12 weeks of leave to employees who are needed to care for their son or daughter because their elementary or secondary school is closed, or their caregivers cannot be available because of a co-virus situation. So we have two parts of this law, one a paid leave requirement, one a leave requirement, and I'll talk about that. So the paid leave requirement states that there are 6 reasons that an employee can take leave and tap this 80 hours of sick leave. One is that they are quarantined by some governmental or health authority. So to some extent, people right now that are quarantined would be the sick leave would be available. Or an employee is seeking a diagnosis because of their health situation, or they've tested positive and need to stay out of work. So if an employee has to take time off for their own health condition related to the co-virus, they're entitled to use this paid sick leave obligation that is imposed on every employer under 500 employees and use that sick leave if they choose to. The sick leave is paid then at their regular rate of pay, but is capped at $510 a day for those reasons related to the self. 3 other reasons, however, that the employee can use the paid sick leave relate to caring for somebody else. So if an employee has to take time off to care for a family member who is seeking diagnosis or is quarantined, or because their child's school has closed and they need to care for them, then that individual can take this paid sick leave and use it, but the cap is less. The cap on pay is $200 a day. So depending on the reason somebody might need to take leave for a co-virus related reason, the benefit that employers must pay is either $510 a day for 80 hours or $200 a day. The second part of the law is the Family and Medical Leave Act amendment. And that says, again, any employer with 500 or less employees has to provide 12 weeks of leave to employees because their child's school is closed or the caregiver isn't unavailable. This leave, the first 2 weeks is unpaid, but an employee is entitled to use any form of paid leave that they have available. After April 2nd, some of the paid leave they will have available is mandated by this law. So whether the employee would choose to use your sick leave or PTO plan or a vacation to get full pay, or take the federal benefit, is up to the employee. Employers can't force employees to pick to use one or the other. It's up to the employee. So the first 2 weeks is unpaid, so an employee can use any form of paid leave. However, if the employee is out beyond 2 weeks, for the duration of the 12 weeks or additional 10 weeks that an employee is unable, it needs to take time off from work because their children's school is closed, the employer has to pay the employee 2/3 of their regular rate of pay, not to exceed $200 a day. So in essence, if schools are closed for 3 months, an employee has to take 3 months off to care for their children because the schools are closed, then they will get $200 a day for those last 10 weeks, which roughly equates to about $10,000.
Hi, John. We have probably a minute more left. I know there's a lot of information, and the slides were emailed to the attendees.
Okay.
But if you could wrap it up, that'd be great.
Let me quickly jump a couple of things. For this law, employers with less than 50 employees can seek an exemption from the Department of Labor if they can show that their ongoing business enterprise is jeopardized by paying these benefits. The second part of it is employers of healthcare providers can exclude healthcare providers as defined under the Family and Medical Leave Act from coverage. Also, there's a refundable tax credit for any monies paid by employers for this kind of leave. I do have to mention that if you're going to furlough or lay off or reduce hours for any employees or close your business, you need to consult with counsel because the Federal Warren Act may require you to give written notice to the mayor as well as your employees. There are obligations to pay your employees under state and federal law in a certain way, making sure that employees get paid their minimum wage and that you maintain the salary basis test for exempt employees and comply with those laws. Make sure that you understand that employees are entitled to unemployment benefits. And that's one of the things we would probably need to cover in more detail later. Sherry, thank you very much for the opportunity to share some of this with you. I know it's a lot to take in, and there's more information on our website at our firm, and I know you circulated the PowerPoint. Just one note, the EEOC is conducting a webinar this Wednesday on discrimination law in the co-virus era at 6 p.m. And the U.S. Department of Labor is taking online comments on this paid leave benefit. And they're having kind of SHRM's doing a webinar on it Wednesday at 2 p.m. So thank you very much.
Thank you, John. If you could stay on, I did see a few questions for you, so we'll get to those after our last speaker. At this time, I'd like to introduce Dr. Chock of Hawaii Pacific Health. You know, I think many of us feel helpless, isolated, and just overwhelmed by this whole situation. So Dr. Chock will help us as leaders to keep our staff informed of the facts and in a healthy state, both mentally and physically. So Dr. Shaylin Chock of Hawaii Pacific Health, it's all yours.
Hi, thanks for having me. I just wanted to start with a short story. So I went into a small business trying to support them, buying what I could. And I also wanted to buy a gift card. And the shop owner said, you know, I'm really worried about selling you this gift card because I'm not sure if I'm going to be able to honor it through this whole thing. I was pretty heartbroken, but I bought that gift card anyway. And I keep telling kind of family and friends to do the same thing, support small businesses because, you know, it's definitely important. So my name is Shaylin Chock. I'm a child, adolescent, adult, and forensic psychiatrist. I work over at Kapiolani, and I'm also one of the faculty member over at UH. I'm speaking to you not only as a physician, but also as a daughter of a small business owner, and also with cousins that have larger and smaller businesses. So this is definitely something that hits close to home as well. The chamber actually wanted me to specifically talk to you about tips for your own coping, tips for parents and kids and adolescents, and then also some tips for your employees. At the end of the presentation, I actually have a slide that has a bunch of apps that are being commonly used and some resources. I probably won't have time to go over those, but they are available to you. So, sorry, I'm like looking at two screens here. Okay. So right now is a big time of uncertainty. Everyone's kind of wondering what's going to happen, where are we going? Nobody really has answers. We have some ideas, and that uncertainty is kind of what's causing a lot of the stress and the anxiety. First, stress is actually a healthy thing. It helps us to kind of activate our fight or flight instinct. That makes us run away from bears. Or right now, that actually causes you to wash your hands and shop for toilet paper. Everyone responds to stress differently. Those that are actually more likely to respond in a more sort of worrisome fashion are older people with chronic illnesses, children and teenagers, and then also those with pre-existing mental health conditions and those with substance use. During this time, I don't need to read the slide, everybody's worried about all of these things. And in this presentation, and I guess for this chamber's practice, a lot of people are worried about financial concerns. So I think that's a concern of everybody, and especially is going to be a concern of your employees. So what can you do to kind of support yourself, right? So you want to definitely limit your media exposure. I know that that's really hard because right now I think everybody's sort of focused on how many cases, what's going on, what can we do, what's the state doing, what's the nation doing, what are the other world areas doing? But it actually can be pretty detrimental to you. What you want to do is actually check in to your media sources, make sure obviously that your media sources are reputable, trusted, but you want to check maybe once or twice a day because you kind of leaving that television or that radio on constantly and constantly hearing numbers, constantly sort of, you know, that being constantly in the background is actually not good for your mental health. The next thing is kind of trying to take control. Right now, we don't have control of a lot of things. We don't know when we're going to be able to be out and about again. But what you can do is kind of figure out things in your own world and in your own life that you can control. What makes sense for you to control? So the first thing is going to be, obviously, you can control how many times you wash your hands. You can control not touching your face. And then even past this virus, you can probably control how you're taking care of your body. You can possibly control, I mean, I can't specifically because I have little kids at home, but you can probably control how much sleep you're getting if you're exercising, you know, kind of making sure you're eating healthily and that sort of thing. So that's going to be definitely important. Then the next thing is going to be plan what you can. And there's a little star asterisk around that because obviously we can't plan for everything. But right now with the anxiety and the stress being so high, there are certain things that you're worried about. For you to be able to actually name what those worries are and what those concerns are, and then make a small plan for yourself, for your family, for your employees. Realizing that the plan's not going to be perfect and the plan can change. But when you feel yourself sort of spinning out and not kind of knowing what's up, what's down, it's nice to at least have a rough draft of a plan that you have thought of before that sort of spinning started happening. Now, to connect with others. I know everybody in the world is saying social distancing. I think the WHO and the CDC is actually trying to change that to physical distancing because we really want to stay social. We want to still be able to connect We still want that human interaction, but obviously we're going to be interacting like this over the telephone, over computers, over our iPhones. So please, please, please stay connected virtually. Check in with family and friends, right? Hopefully you have a few minutes in your day. You can check in on an auntie or an uncle, kind of see how they're doing, call. Maybe for your families, kind of make times where you guys can get together and video chat with each other to just kind of check in on everyone and stay connected. I'm kind of in contact with a friend, and she and I kind of have dark humor and we kind of make jokes. But it's a really good time, even if it's just for 2 minutes or 3 minutes a day, where you're actually connecting with someone else and doing something that helps you to feel good. I talked about taking care of your body. With regards to your mental health and well-being, a big thing with that is there's actually been a lot of research and evidence to show that mindfulness, meditation, and yoga are big things right now, and have been for a while, that can help you kind of center yourself and find sort of that nice space where you have a few minutes to be calm and not stressed out. People are saying, well, what's mindfulness? That might be a new term to many people. That's actually just being present in the moment and paying attention, doing it intentionally and with non-judgment. So basically, it's deliberately thinking about, what is my breathing like right now? Am I taking a deep breath? It's deliberately thinking about, wow, I'm home with my kids, and look at how much my child can now run, or how fast they can run. Really being intentional, about the actions that you are doing and those things that you are experiencing. And then the next thing is focusing on what you're grateful for. Right now it's hard. I know it's really difficult. We're worried about business, we're worried about health, we're worried about everything kind of else around us, but what are you grateful for? And kind of reminding yourself, even if it's just once a day before you go to bed, thinking, what am I grateful for today? It's actually also a really good thing to do with kids. I do that with my own kids around the dinner table at the end of the day, and it's kind of nice to hear. Sometimes I'm grateful that you let me eat a lollipop, but hey, take what you can take. And get help. So there are a lot of apps that have been proven to be helpful during this stressful time, and there are apps that we use with our patients that have anxiety. And then if you find that you are sort of spinning to that point where I'm, needing more than what connecting with others can do. I'm needing more than what an app can do. I'm needing more than breathing and yoga and meditation. Seek out and reach to professionals. You can possibly schedule, we are scheduling virtual appointments with our psychologists are still seeing patients. Myself as a psychiatrist, we're still seeing patients, and we're doing it either over video or telephone. So we are there to still help you and support you during this time. Now to support your kids. That's a hard thing, right? We want to talk to them, we want to explain to them, but we also don't want to scare them. You really need to figure out how old your kid is and sort of what's developmentally appropriate to talk to them about. There's a really good resource by MindHeart, and it's usually for kids that are under 7. So if you can see this little square on the bottom with the virus with its eyes on it and glasses, there's actually a downloadable little book that you can get, and they have it in multiple languages, that you can actually use with your kids. It talks about the COVID virus, it talks about how it makes you sick, it reinforces hand washing and those types of things. So that's kind of a big thing, is to not to try to keep it from them so much because they're going to hear it, but at the same time be able to talk with them. And the idea of you being able to sort of narrate that conversation and navigate that conversation. The next thing that they're going to need is the reassurance that they are safe. Let them express to you if they're worried, to ask them, well, how are you feeling? What's going on? And remind them, we are going to keep you safe. We are doing this together. Our community is trying to keep you safe that's why you're having to stay home. But just very basic, and making sure that they do feel safe in the environment that they're in. The third and the big thing, again, just like for you as an adult, is to limit their exposure to news coverage. There are a lot of families that we've been working with who leave that television on constantly. And to us as adults, it's in the background. We don't hear it. We don't really pay attention to it. Sometimes you might be doing something, you might check in and say, oh, okay, that's what's going on. But your kids aren't able to sort of sort and filter. They're not able to figure out, oh, that's not really pertinent to me. That's happening in Italy. they'll take little snippets and in their mind sort of make it into something. So it's really important for you to limit that news coverage, and the coverage that you do choose to watch. If they're watching with you, that's another good opportunity for you to be able to say, hey, what are your questions? Let's talk about this. Be honest with them. You're probably stressed out, and you can say, I'm stressed out. How about you? It's a nice way to sort of talk about what's going on for them. And then trying to keep a regular routine. I think right now everybody's struggling with kids at home. I mean, speaking for myself, I have 3 little kids at home, and it is rough. You want to come up with a routine, not a schedule, because a schedule implies time. And let's be honest, with little kids and with teenagers, it's hard to kind of stick to a certain time schedule. So if you come up with routines and they sort of know when and what to expect when and throughout the day, that's something that will help them and will also help you. It also helps me to figure out when can I get some work done, when am I going to make patient phone calls and that sort of thing. But a routine is really important. And then just like for you, finding something that they can control. A nice thing for kids, teenagers, is figuring out, allowing them to plan something, having them figure out, what should we do? What kind of home activity should we do tomorrow? Why don't you help me plan the meals for the week? You could also turn that into an educational thing. Okay, you think that our family should have this. How much, meat do we need? How much cheese do we need? That sort of thing.
Hi, Doctor. We're nearing the end. I apologize, and we still have several questions.
Sure. This is the part that I really want to show. So the main thing with kind of supporting your employees is going to be looking at you as a leader. So employees look to leadership to provide a path. There's been a Gallup study that looked at global worries over, all of the great big things: the Great Depression, Pearl Harbor, World War II, Kennedy assassinations, riots, 9/11, and also the 2008 global financial crash. And what they found is employees are looking to you to be trusted for your trust. They're looking for you to be compassionate. They're looking for you to be stable and to provide hope. Gallup actually put up this tool on their website, and that's here. And these are sort of the questions that you can easily ask your employees to see where they're at. If you can show them that these things that you're trying to do, they will definitely be more willing and able to work and continue working. Some of the other things that you can do for them is check in with them. You can also encourage them to be taking breaks, staying hydrated, taking care of their bodies. And then also you might consider sharing or subsidizing apps, podcasts, and online programs for things that are proven. Again, the mindfulness, the meditation, and the yoga. There's a slide here that kind of has all of the apps that, have been sort of shown to work and help. These are things that you can definitely look at later and on your own time. And then this is just a slide kind of going over. For you, avoid excess media, and then there's things about isolation. The last slide that you can definitely look at on your own time as well is more resources and references with regards to children, adolescents, and also general adults and key workers. I think a big thing though is honestly checking in with your employees because they're looking for you for leadership. And I know we don't have a clear path, but the idea that you can be honest with them and show them that we're all in this together, I'm going to be the best leader that I can, is going to be huge for your employees. The big thing is that the employees look to you for leadership, and during these types of crises, they definitely look to you as a leader of the business, as a leader to guide them. And they also found that most employees trust their employers most with regards to information, even about viruses and things that may not be within your sector. So I would strongly suggest and recommend, if you have a large staff, to use this COVID-19 leadership audit to see how you're doing as a leader. And then if you don't have a large staff, and even if you do, making sure you're checking in with your employees. All right, I think I made it sort of through.
Thank you, Doctor. Really appreciate
Sure.
it. I couldn't have agreed with you more. Mental health is so important as well as we manage through this situation. We're going to go straight to Q&A. There's a number of them for John, so I'm going to go over them. One is, if they are traveling after knowing of travel restrictions, in coming home, they must self-quarantine, but are those 2 weeks required to be paid under this new law?
No.
Okay, so simple no, great. If an employer is closed due to being in a non-essential, do they still have to be paid sick leave in this new COVID labor law? Because
Say that again?
if an employer is closed due to being non-essential, do they still have to be paid sick leave in this new COVID labor law? Because they're already laying off a majority of their staff. So
Right. If an employee is not working, then they're not taking time off, so they don't have to be paid if they're not working.
Okay. Can non-exempt employees also telecommute?
Yes, non-exempt employees can telecommute, but it's the Fair Labor Standards Act and state law would require you to make sure that they track all the time that they actually work. So it'll be important to make sure that your employees are accurately recording all the time they work and you're paying them for all the time that they work.
Okay. Can they still sign up for the SHRM Hawaii webinar?
I believe so. That's the National SHRM is going to conduct one on the law this Wednesday at 2 p.m. Hawaii time.
And then where can they see the new COVID law?
It's House Bill or House. You can pull it up online. It's HR 6201. And if you look for that, you'll be able to, if you search for that, you'll be able to pull it up.
Okay, this is for Dr. Bonham. If industries such as hospitality sustain reduction in the next 3 to 6 months, even through recovery, what industries could potentially absorb job seekers? Are there any forecasts as to what sectors may potentially see growth or increase productivity as a result of the current impacts to the local economy?
So the problem with thinking that some other sector will be able to pick up the job losses from hospitality and tourism is that the rest of the economy is going to be affected by lost wages, lost income, lost output associated with both the shelter in place for those who aren't essential and aren't able to work from home. So for example, you could imagine that construction might be an area where you could see some pickup in employment if there was a surge in government spending. That's almost impossible to surge, but if we have a need to do infrastructure investment, housing investment, and so on, but they're facing lost hours and lost productivity now from shelter in place, and the businesses and the developers are facing severe liquidity problems going forward, and uncertainty about whether development of certain types of property, certainly anything that's related to tourism, should even be pursued at this point. And so, I mean, outside of healthcare and potentially some state and local or federal government employees that might be funded by federal stimulus, there isn't a sector that's going to significantly take up slack.
What about the ag industry? That was another question. How will they play a role?
Well, I mean, the agricultural industry right now, the key thing is that we need, so everything takes time to make these changes, right? But we essentially need to be in a place where we are able to reopen farmers markets to drive-by pickup. So, and even that is may not be enough, but the ag industry that has been growing fresh produce and fresh meat and other things, where the bulk of it has been sold into the hotels and the restaurants, they now need different customers for as long as necessary. And there are people, there are local buyers who will buy that produce and that meat and other things. And one of my favorite ag products, locally made beer. How you get that to the customers is the challenge. And some of these things have to be built from the ground up. Some of them are in existence and they need to be expanded. But again, you're unlikely to see a surge in agricultural employment because of this event. I mean, there's room for some, but they have to have a market to sell their product, and they were selling much of it into hospitality and tourism.
Great, thank you. The next question is for Jane. Did you say that nonprofits can apply for SBA loans? And if so, what tax statuses are included? So C3, C4, C6.
Oh,
You may have to unmute yourself.
Okay, sorry about that. Yes, nonprofits may be eligible. It would not include charitable organizations or religious organizations. I will have to check before I would say C4, C5, C6, but if you look at educational organizations, cultural and some arts organizations that are nonprofits, preschools, some of the health clinics and things like that are nonprofit in the way they are established, would be eligible. So you could give me a call or just shoot an email to hawaiigeneral@sba.gov if you have a specific entity in mind. For example, we had somebody call today because they have a catering business or small restaurant, a preschool that's affiliated with a religious organization, a church. So, but they're separate entities. So a lot of it depends on how you file your taxes. So we go on this is one that I would look at on a case-by-case basis and seek some expertise in helping us decide. And oftentimes it's like put in an application and that will be a determining factor.
Thank you, Jane. This is for John Knorek. If an employee is pregnant, will it be acceptable to keep his or her medical while furloughing?
say the latter part, I couldn't quite hear it.
Sure. If an employee is pregnant, will it be acceptable to keep her medical while furloughing?
Her medical file.
I guess medical insurance while furloughing.
Oh, while furloughing, yeah. This is an area we couldn't get into on what employers can do while employees are either laid off or furloughed. Employers can continue to pay an employee's health care premiums. Now, many of the insurers in town have language in their policy that say if the employee is actually not working the 20 hours a week, then they are not eligible for coverage. My understanding is HMSA has said they are not going to enforce that. They'll let employers continue to pay for coverage for employees that haven't been working for 4 consecutive weeks and for now during the emergency. I've not heard from the other carriers, but it would be something everybody should check with their carriers to make sure they can do that. So there's nothing illegal about it. And in fact, if they can't and an employee has to take COBRA, employers could pay the COBRA premium. So it's not required, but it's a nice thing that some employers are doing during this crisis.
With accrued PTO, must that be paid out if there is a layoff?
If your policy says when an employee is terminated, you pay out their accrued PTO, then yes, the state wage and hour law says if you terminate an employee, you pay them their wages due in full at the time of termination or no later than the next business day. PTO and vacation time is not included in wages, but the state will enforce your policy. So if your vacation and PTO is paid out on termination, you pay it. If they're laid off, it's not deemed a termination under our wage and hour law in Hawaii, and you pay off the PTO and their wages at the next regular payday. But if your policy says we do not pay out PTO or vacation on termination, then you don't have to pay it.
Okay, there's
Now, wait, I want to clarify, is it okay to pay for the premiums for a pregnant female that's on furlough? Yes, but you would have to pay them if the employee was disabled and unable to work because of her pregnancy. So if the reason the employee is not working is disability related to pregnancy, the Prepaid Healthcare Act would require you to continue their healthcare coverage for the balance of the month in which they were disabled due to pregnancy, plus an additional 3 months. That's state law. But if simply because they're furloughed would not trigger any obligation to continue the health insurance past the month in which they ceased working.
Okay, there's quite a few more questions, and I'm just going to ask one more question, and we will get back to you, to those who did not have a chance to get to. So the final question is it legal to ask an employee if their spouse was exposed to a coworker who tested positive for COVID?
I believe so. Yes. You're asking an employee if their spouse was exposed to or somebody in their house, anybody in their household was exposed to somebody that was diagnosed positive for the COVID. I think that's a legitimate question to ask.
Great. Well, thank you. And thank you to all the panelists for participating. I know there's going to be a lot of other questions moving forward. And, we wish we could have a longer webinar, but obviously we already went over time, so apologize to the attendees. If you do have a question, the Chamber created a COVID website. So please go to COCHawaii, spelled out, .org. That's COCHawaii.org. You'll see a link there that goes to our COVID-19 website, and we have a Q&A section, as well as a section where you can provide comments, or if you have services that you want to offer, or services that you need, everything's on there, and we want to make this as a hub, a one-stop center, so that we can all move through this together. So thank you to all of you for participating. It's definitely challenging and unprecedented times. But by doing our part, by working together, we will beat this virus and rebuild a stronger and a more resilient economy. So again, thank you to all of you.
Thank you, Sherry.